If you have been curious about the difference between a heart attack and a stroke, I'm talking to my perimenopausal, menopausal women who are noticing that life is definitely changing from a health perspective. Studies show that the perimenopause and menopause phase has a way of showing up in terms of our heart health. And what better time to have this conversation during a month where there's a spotlight on it? But most importantly, how often do we get to talk to a pharmacist? So, if you are looking for a conversation that will empower you or motivate you to think twice about your heart health, you want to hear two women having a conversation on how we advocate for our health because you're looking for some tips, well, then, sis, this conversation is for you. It's your girl, Coach Nick, with Beautifully Well Conversations. And joining me for this prelude to a deeper conversation is no other than Maisha Mac, pharmacist, Zumba, Rolly, Mommy, Empire Builder. Okay, I could go on and on and
All
on.
right. I just want to thank you for that warm welcome. And I'm excited to be able to impart some information to really empower our community, our women, and provide any type of resources that I can. So thank you for this great opportunity.
I'm
So
excited.
yeah. Okay, so let's just get right in it. And I'm going to try to keep this as simple and simplistic as I can. If I go, I like for people to explain things to me, like Denzel said in that movie, like I'm a sixth grader.
Absolutely.
so, so one of the things I can say is when we look at heart attacks versus stroke, the heart attack is an interruption of blood flow to the heart. The stroke is an interruption of the blood flow to the brain. So those are the things that if we just want to go on the most basic level, the difference between a heart attack and a stroke, okay? And some common early signs and symptoms of the heart attack are mild chest pain that slowly starts and it comes and it goes, right? Discomfort in the arms, your back, your neck, or your jaw, nausea or abdominal pain, dizziness, lightheadedness, shortness of breath, with or without exertion, okay? So those are some of the signs of the heart attack. Now, the stroke can be a little more subtle, okay?
Mm.
Some of the symptoms of the stroke include a mini stroke, like a sudden headache that you may not really pay attention to, but it's just like nagging at you. Numbness or weakness, especially on one or more of the side of the body. You may be caught off balance with walking. You may start to get confused, difficulty swallowing. And as we know that a lot of those things happen, they can just happen. So sometimes that's why I believe it's a little more subtle with the stroke or the mini stroke, because you could be experiencing those things. That doesn't necessarily mean that you're having a stroke. But the important information, the important part about this information is awareness, right?
Absolutely. In a
Yeah.
breakdown, you broke it down so simply. I'm going to aim to get this right. The heart attack is based on blood flow's inability to reach the heart, whereas the stroke is a reduction in blood flow to the brain.
Yes.
So, what key chronic conditions or illnesses can lead to either one?
Well, I believe that a lot of them are interconnected, right?
Yes.
Of course, high blood pressure. Um, High blood pressure is one of the main ones, right? And that goes with our lifestyle and our diet. So there's levels to this. You
Yes.
know, diabetes, which is linked to our lifestyle and our diet. So I would say those are one of the two of the most prevalent um ailments
And
that
most
we're
common, you know.
Yeah,
Yeah.
especially in Black women, right?
Household names, throwing that cholesterol in there too, that elevated cholesterol.
The cholesterol. Yeah. I mean, there's so many chronic illnesses that can ultimately affect your blood flow. I like to take it way down to your lifestyle,
Yes.
your movement. That was a big piece even for me as I was a borderline diabetic, especially during my pregnancy. I went through about a prediabetes and my blood pressure went up, preeclampsia. I experienced those things as well. And I consider myself to be a pretty healthy person. So sometimes, there are genetics involved. There are certain conditions involved. I know sometimes we're considered when we're pregnant to have a disease state. That's just the terminology that's used sometimes, but that's a temporary thing. But I realized that after I had birth, I had to really make some changes. For
Oh,
one,
well.
to get the weight to come off, and two, I had to really be aware of my blood pressure and my sugar levels, right? Because
Mm.
that sparked something for me. I didn't pay. I was so healthy before I got pregnant. I didn't have anything going on. And then I just had to be aware, right?
Oh, that's the word.
Yes. And my movement through the day is directly related to how the blood is flowing, how it is reaching my brain, how it is reaching all of the organs into my body. That movement is so important. And coming from a high cardio activity driven life where I was
Like
teaching Zumba
Zumba.
and doing Zumba, after a while, my body couldn't do those things anymore. So it's like, okay, what can I do on a daily basis to get the blood to flow? And guess what? When I would sit down and listen to a song and clap my hands, I'm moving.
Absolutely.
When I get up and I stand up and take a deep stretch and breathe deeply in between a commercial break, I'm moving.
You hit it on the nose. Exercise. We're
Yeah.
forgetting the exercise factor. I talk a lot about nutrition. I love food as medicine. Movement is medicine. And we're not talking enough about in simple ways, right? That I think some of us who are not exercisers, that we think that our routine has to be what we're seeing, what we're exposed to socially. But what you're saying is the first step is just to move. Evaluate where you are, start moving.
Yes, because once you recognize that if you're not a gym rat, you feel very uncomfortable. You don't even want to turn on a YouTube video. We can simplify these things. When I sit down and I talk to people who are just depressed because they're not motivated, I will meet you deep into how you're breathing. Do you know that you can take 20 deep breaths and feed your molecules oxygen? There,
Hello.
there are books and studies of people who did deep breathing and were able to really, one, calm down their nervous system. Sometimes we have these trigger eating issues going on, and it's like take 10 deep breaths before you decide to make a move, before you decide to gorge and eat. Just regroup, because sometimes we're on autopilot and we're stressed and we're doing things we don't even realize that we're eating to soothe ourselves, or we're eating out of habit. We're not even hungry. So I go back to the breathing. And I did some research and I read that when you breathe, that's how you exhale. A lot of fat comes through breathing. I
Mm.
had to Google that. That's how we exhale. We can actually exhale fat molecules out of our bodies
Out.
by doing deep breathing.
I
So,
love it.
yeah. So yeah, I would like to see everybody do a certain amount of activity and movement, but it may not be conducive for everybody. But guess what? If we have the opportunity to breathe, let's start there.
Intentional breathing. Oh,
Intentional.
yes.
Yeah.
It's you shared a little bit in our conversation last week, and we're just giving our audience a teaser so they can look forward to a deep dive. But you and I have so much in common. Zumba, the picture of health, knowing in the healthcare space, understanding what healthy is, and yet you still faced a few challenges. Myself, pre-diabetic at one point, life showing up in crazy ways, but this advocacy for our health. I just want to wrap up and touch on this. Why is it so important for us, everyone, period, but our focus is women, for us to be an advocate for our health and talk a little bit about how we need to do that?
Well, as a health professional, I don't believe in cookie cutter systems, right? And we have standards and guidelines, and sometimes they're not always based on our culture and makeup. And so, with that, it's good to have conversation to get as much knowledge as you can. We have a lot of information about other people who have done the things that we are trying to do. Like, for instance, if you go and do a DNA test, there are certain attributes that we have that can lead us and guide us. For instance, I did a blood test and I was told that through my DNA, red meat worked out best for me, beef. And I was just shocked because that's from the studies of my DNA, which was recommended. Now, I will say that I did more research and I lean toward natural and holistic grains and fruits and vegetables. But I also, it prompted me to do more reading. Like, what is this all about with my blood type? But the biggest thing is seeking the information and making a conscious decision. So, as a health professional, I I try not to impose my personal views. I just share the information and the knowledge base so that the person that I'm speaking with can make the best decision for their life. And I even would say it's okay to challenge the information that I'm giving you because this is called a practice. And a lot of things we are learning. That's why there is no I don't look at it like it's this is right and this is wrong. Like, let's unpack this, let's explore this, let's look at the data. And that to me is the first level of advocacy. Talking to someone that you feel comfortable with, that you trust, getting the information. Um, and if you have something that you're challenged with, going back and reviewing that, getting second opinions, that's the first start. If you're able to do those things, right? I have some adults that are very close with me that were having challenges, even talking to another health professional, and they came to me. That's part of the reason why I went to pharmacy school. You know, when I was young, we used to go to the pharmacy. There was nobody back on the other side that looked like us. And my auntie, she didn't understand anything about, she couldn't pronounce the medication. She didn't know, and I couldn't help her. And I'm sitting there, and I've had some family members before I, got my pharmacy degree. One, I believe transition because they made a mistake with their medication.
Exactly.
So these are part of the things of advocacy that have prompted me to go into the health profession, and also it's helped me. You
Mhm.
know,
We're our first patient.
yeah. Yeah, and we haven't sometimes when you're in the middle of certain behaviors, you can't always see them. That's why it's good to have people who love you, who can point these things out to you. Like, sometimes I forget, when is the last time you've gone and you've had your blood pressure taken? You're taking
Right.
all of your blood pressure. So yes, awareness, advocacy, and advocating for yourself. We
Yeah.
all have to take responsibility for our health.
And those symptoms you shared, we know those symptoms can parallel other conditions or illnesses.
Yes.
But I will share, and thank you for chiming in on advocacy, because it also includes not feeling like when these symptoms occur that you can just brush them off. you
That-
know and how often do we say, this not a big deal because I've been dealing with this for a few days, right? Assuming that it's linked to something else. I know you and I have heard numerous stories of women who have experienced a heart event. And one of the things they all say that they have in common are some of those very similar symptoms that they neglected. They didn't feel that it was moving in that direction, and it certainly was.
Absolutely. And can I add on to the whole premise of some of these disease states being a silent killer? Because it's not so much that they're silent. A lot of times it's that we are not listening.
Oh,
Yeah, that's
mic
part
drop
of it.
it.
Now, I will say, with the taking responsibility, sometimes we do have conditions going on and we don't know what our numbers look like. Sometimes our blood pressure may be borderline high, and we've managed stress, or we believe we are managing stress to a place where we don't even realize, we don't even notice, and we don't have a clue, and we continue to go to sleep and put everything on a good night's sleep. And sometimes people do not wake up from that sleep because they're having hypertensive issues when they lay down. So that's why it's good to develop some type of protocol for yourself where you go and you get an annual checkup. You go and you go to a dentist and you get screenings done, and it's good. There are a lot of different resources available for people who don't have insurance where they can get certain screenings done. You can seek out that information.
It's
Yes.
and at the end of the day, not belittle these symptoms. It's for all women, but especially in that perimenopausal, menopausal stage, because it increases the risk factors are greater. And literally, as you mentioned, we can't sleep on this because we
Oh,
sleep on it. We say tomorrow I'll feel better, but maybe I'll go tomorrow. But how important it is to, just recognize when we're not feeling well.
and
And
that and that
yeah,
and that involves getting in touch with yourself, getting in tune with your body, getting in touch with yourself, because a lot of times during our days, when we're our 24-hour day, it's a lot that happens to trigger our stress levels, right? And how do we unpack that? Do we just keep moving through? We don't realize a lot of times the level of stress we have to deal with just on a moment to moment basis, where we normalize that, especially as women and especially as Black women. We take on so much. I've probably operated under a level of stress for many, many, many years. And we just become that superwoman. And that's the thing. I want us to give each other grace and space to just do what you take. Like, you offer a stress reduction, you offer those types of programs, right? We need to
yeah,
take advantage of those types of things. They really are life-saving and crucial. Come off of the autopilot and give
mm.
yourself some space to breathe, right?
Grace and space. I think I'm going to copyright that. I think
Oh,
we need
yes.
grace in space.
Oh, yes.
It,
Prioritize your health,
yeah, that
right?
has to be. We can't do everything for everybody if we're not there to do those things.
That's the first thing you can do, is
Um,
carve something out for yourself.
yeah, it's generational health. I call it,
Yeah.
right?
Yes.
Knowing your numbers, right?
Yes.
You know when you don't have enough money to buy what you want to buy in a bank, or what expenses are coming out automatically certain days of the week, and when direct deposit hits, those numbers. But when it comes to your average blood pressure, are you pre-diabetic? Do you have type 2 diabetes? Do you know LDL versus HDL, right? Some basic, like you said, low level, like a sixth grader can understand if my cholesterol high, if my blood pressure is elevated, if I'm in a pre-diabetic phase, those things we need to know, and we need to know ourselves and position ourselves to not be okay with not feeling well, no matter how small a symptom. may be, that we address it.
Yes.
And we make sure our healthcare team is comprised of people who are willing to give us an ear and the
Yes.
time that we need. Yeah. So this was
Very
awesome.
great. Yes.
Love this conversation. I know you're a busy lady. You carved out some time on this crazy Thursday with the pretend snow every other hour, right? But I'm glad that we were able to start this conversation because you can only imagine how deep we can go in this
Yes.
follow-up conversation where we get even deeper with some of those questions. Every woman needs to know that only a pharmacist in the healthcare space can answer. So thank you for joining this beautifully well conversation. And we look forward to our next conversation. You are awesome.
Thank you so much for this opportunity. And I'm excited to continue talking. You make it so easy. And I just want to thank you for giving me an opportunity to share.
Anytime.
All right. You take care.